My name is Christina Runge. I'm a medical doctor and PhD student at Statens Serum Institute, Department of Epidemiology Research in Copenhagen, Denmark. We thank for the opportunities to present our work as a video abstract. On behalf of the co-authors, I'm presenting an article published in Clinical Gastroenterology and Hepatology entitled Inflammatory Bowel Disease and Cervical Neoplasia, a population-based nationwide cohort study. We know that persistent infection with high risk oncogenic types of human papillomavirus is necessary for the development of cervical dysplasia and invasive cervical cancer. Most infections with human papillomavirus regress spontaneously. However, some persist and progress, and it is not obvious why some people are able to clear their infections and others don't. The risk of cervical dysplasia and invasive cervical cancer in inflammatory bowel disease remains debated. Some studies suggest an increased risk, where others find risk to be no different from the non-IBD population, unless patients were smokers or on a combination of corticosteroids and immunosuppressive drug therapy. This is a Danish nationwide cohort study where we combine information from several Danish registries. The study design is a matched cohort study with matching on age, gender and municipality. The source population consisted of approximately 4 million women living in Denmark from 1979 to 2011 and was established by use of the Danish civil registration system, in which all Danes are registered by a personal identification number. This number is unique and constant throughout life and makes links between the national registers possible. To identify patients with IBD, we use specific codes for Crohn's disease and ulcerative colitis. For each IBD patient, we randomly sample 58 matched female controlled persons from the general population who lived in the same municipality as the IBD patient at time of first IBD diagnosis. Cox proportional hazard regression was used to calculate incident-weighted ratios of three main outcomes. First, we analyzed participation to cancer screening. Second, we analyzed the risk of cervical dysplasia, categorized as low-grade dysplasia or high-grade dysplasia. The last includes carcinoma in situ. The third outcome was risk of cervical invasive cancer. We also performed a reverse analysis on the same population. Here we analyzed the odds of being diagnosed with high-grade dysplasia or invasive cervical cancer prior diagnosis of IBD or index date for control persons. We found that patients with ulcerative colitis had a slightly higher participation in routine cervical cancer screening than the matched controls, whereas patients with Crohn's disease participated in cervical cancer screening as often as their matched controls. Patients with ulcerative colitis had only significantly increased risk of high-grade dysplasia, whereas patients with Crohn's disease had significantly increased risk of both low and high-grade dysplasia as well as invasive cervical cancer. In the reverse analysis, where we analyzed the odds of cervical neoplasia before inflammatory bowel disease, we observed markedly increased odds of high-grade dysplasia and cervical cancer up to 9 years before diagnosis of ulcerative colitis or Crohn's disease. In conclusion, in this nationwide cohort study on patients with inflammatory bowel disease, we observed that patients with ulcerative colitis only had increased risk of high-grade dysplasia, along with a slightly increased frequency of cancer screening as compared to controls. Women with Crohn's disease had increased risk of low and high-grade dysplasia and invasive cervical cancer, despite a similar screening intensity as in the general population. Of note, we observed in the reverse analysis markedly increased odds of being diagnosed with high-grade dysplasia or invasive cervical cancer up to 9 years before IBD diagnosis or index date for control persons. This may indicate a common susceptibility between inflammatory bowel disease and cervical neoplasia. However, it needs further investigation. Thank you for your attention. We hope you find reading the full article interesting.